Hey everybody, so today we're going to start talking about acute back pain. Acute back pain is where things get a little bit more complicated. We commonly call this just a pull of our back, but there's a lot back there that might have been pulled, and it's hard to figure out what is what. So we're going to start today by giving you a video that goes through what I look for on an exam to help me out and correlate my findings with your imaging and radiology. As we talk about in our pain video, structural findings on radiology and pain are not always well correlated. So part of our job in healthcare is to match what we see with the more functional movement type of testing. So today we're going to start with the first in a series of talking about these tests, what I'm looking for on them, and one of the biggest diagnoses that many people worry about. So let's talk about these structures, the biggest worry being discs. Bulging and herniated discs sound terrible and can feel worse. So what we're looking for on the physical part of our exam is to make sure that the disc is the problem. The theory right now is that discs, being malleable and soft, conform to our movements. The worry with the disc is that when we bend forward, we place pressure on the forward part of our spinal column, pushing the malleable disc backwards towards the spinal cord itself. As we push on that cord, we can really put pressure on the nerves, which tends to make them angry. So if we're putting pressure on nerves, we should see pain that starts to match the length of that nerve. In the case of our lumbar spine, this means pain that runs down the back of our leg usually, sometimes as far down as our toes. The good news here is that if there's a motion that moves the disc the wrong way, there should also be a way to move the disc away from the spine, decreasing pressure on that nerve. We've seen some actually really good studies that show that discs can be reabsorbed into the body when injured. So part of our job is to determine what we can do to keep the pressure off that nerve while they do that. The McKenzie method of treatment, which is a popular approach that helps us classify what we call directional preference of movement, helps us to try and figure out which way we can move to avoid sending the pain down your leg. Then we can also figure out if we can promote a direction that centralizes pain, which means moving it away from our toes and legs further towards the center of our spine, meaning that if it runs less far down the nerve distribution, we should also be putting less pressure on the spinal cord itself. One of the important things to know, though, is that there are actually a lot of injuries that masquerade as a disc issue. They have a lot of similar symptoms. Your doctors or therapists are going to be trying to check you for things like a hamstring injury, something like IT band syndrome or piriformis syndrome. All of these can masquerade as together one giant group of what we call sciatica. Things that run down the same distribution as, of course, the sciatic nerve, the same area that could be put in trouble if we have some sort of pressure on the sciatic nerve up in the lumbar spine where it originates. These radicular symptoms, regardless of what they're coming from, are an important sign that we should get to our doctor right away. Because if it is a nerve issue, we want to make sure we address the cause of it before any problems arise from damage that could be possible to that nerve. Again, if you have any questions about what we're seeing, if flexing forward is creating pain running down your leg, if flexing backward is eliminating it, and how you should go about treating it from there, your physical therapists and doctors are here to try and figure out what we can do to help you. If you have any questions, as always, please let us know and we'll be happy to see you. Have a great day.